For some answers, let's turn to Dr. Calvin Sun. He's attending physician and clinical assistant professor in emergency medicine in New York, and he joins me from New York City. Dr. Sun, in addition to Texas and New Mexico, there are now measles cases in Alaska, California, Georgia, Kentucky, New Jersey, New York, where you are, as well as Rhode Island. How worried are you, and why are we seeing such an alarming spike in cases?
Yeah, well, there are consequences when you don't wear your helmet and you get into a bike accident and you hit your head. There are consequences when you don't wear seatbelts and you get into a car accident, and everyone's somehow blaming that the seatbelts don't prevent car accidents or helmets don't prevent bike accidents. That's what vaccines do. They're not necessary to prevent things from happening. They're supposed to lower your chances of ending up at the hospital. And what we're seeing is the consequences of actions of not doing certain things that will lead inevitably to these outbreaks when they happen. The measles R0, which is how many people you infect with one case, is up to 6 to 9 times more than the R0 of COVID. So we couldn't even figure out who the patient zero was for COVID, and there was an outbreak in wherever community there was, but it still spread around the world. And if you're telling me measles is 6 to 9 times more infectious, it's going to be really hard to find out who started. But the fact of the matter is that 2 people already died from something that no one died of for decades.
Well, talk about the symptoms and also the dangers of getting measles. Of course, the worst case scenario is death. Well, what do parents need to be aware of?
Well, first check. I mean, I hope as a good parent, you know your child's vaccination schedule and your kid is vaccinated for all of the things that are they wearing a helmet? I hope you're a good parent to check if your kid is wearing a helmet when they ride a bike, or they wear a seatbelt when they're in a car, or you know what your kid has been vaccinated and protected against. Otherwise, I have a few second thoughts about your ability as a parent to not know these things. I don't care what you decide to do. That's your prerogative as a parent. You do whatever you want, but do you know if your kid is protected? That's the first thing. And if they are, then you can breathe a sigh of relief because your kid's wearing a helmet. You're doing the best you can. But if your kid is not, then you have to watch out for the symptoms. It's a full-blown rash that could then lead, if unvaccinated, unprotected, without a helmet, without a seatbelt. When things happen, they're going to get a pneumonia and brain inflammation, which an inflamed brain causes, more likely than not, without a brain, you're dead.
Dr. Sun, yeah, I'm sorry for interrupting you. I'm running out of time, but I got to ask you about this outbreak is, of course, the first major health crisis for Health and Human Services Secretary Robert F. Kennedy Jr. He has recommended parents consult with their doctors. He also says the decision to vaccinate should be a personal one. What is your message to the Health and Human Services Secretary?
Nope. We lost signal.
Uh-oh. Have we lost you, Dr. Sun?
I'm back.
Okay.
Yeah,
Did you hear my question? It was your response to Health and Human Services Secretary Robert F. Kennedy Jr., who has recommended parents consult with their doctors and says the decision to vaccinate is a personal one.
First of all, you have every right with freedom to decide what you want to do with your child, but you have to accept the consequences with those decisions. And if that consequence is worth the risk, like an inflamed brain and a dead kid, that is the consequence. And we don't want that as a doctor. Secondly, RFK, what medical school did he go to?
I don't know. I don't follow his education or his career. I just tell you as a journalist what he said.
On their own, would they want to trust what the credentials are? But does he swear to the Hippocratic Oath? Did he swear to do no harm? And the answer is he didn't go to medical school. He didn't swear to those things. He doesn't have a fiduciary, if you will, like an accountant has a fiduciary responsibility to their clients, like a lawyer has the responsibility to the client-lawyer privilege. He doesn't have that. He has not gone through that. So if he says it's your choice and he's in charge of whatever it is, and you decide that for yourself, then there are consequences to making that decision.
Understood.
I prefer to wear a helmet and wear a seatbelt.
Understood. Understood. Well, we'll leave it there. Dr. Calvin Sun, thank you.
You're welcome.